I want to talk about ice a little bit now, and what I really want to do is get people to think about what they're doing when they're using ice on their own injuries or on their horse's injuries. I'm sure most of you have spent a lot of time cold hosing their horse's legs when they've had a leg injury, a tendon strain or something like that. And I just want to throw a few things out into the public here. When I first started to study physiotherapy quite a long time ago, ice was recommended as part of treatment, especially if the patients had a lot of pain or swelling post-operatively or after an injury. And I have never been really a fan of it. And once I qualified, I don't think I ever really used it. I can't really remember that I used it. I'm not saying don't use it for a fresh injury. You've got a fresh ankle sprain or whatever on the playing field, bang, boom, you put the stuff on. It's okay. I think there is some value in it, but it must be done immediately. I think even half an hour after the injury has occurred, I think it's too late. Just think about what we're doing, because imagine you've got a bit of meat, and if you want to keep it fresh, you put it into the fridge or into the freezer, because it slows down the metabolism of the bacteria. So they get, I don't know, frozen as well, or, so their metabolism slows down or stops altogether, and the meat stays fresh longer. So if we put ice on a fresh injury, aren't we slowing down our local metabolism of the cells as well? And do we want to slow down metabolism in a fresh injury? That's when everything has to happen. Inflammation is the first stage of healing. We need inflammation because the blood vessels widen, and they bring in all the blood or all the stuff that is needed for the healing. So why do we want to cool it down to slow it down? I personally don't get it. The other thing is also physios quite often, after knee replacements, for example, use a drop and dangle technique, where the patient is asked to hang the knee over the edge of the bed and let the lower leg dangle down. They're told to do this maybe 10 or 15 minutes to make use of the creep. Cool, but then they put ice on it. Now, if you remember what I said earlier, part of the properties of creep is that the temperature is important, and actually when we cool it down, it actually inhibits creep. Creep works better at higher temperatures. So why do we want to drop and dangle the injured tissue over the edge of the bed to make use of the creep, and then we put ice on, which inhibits the creep? I don't get it. Also, someone did a study, I don't know, in the 1980s or something, that said that the benefits of stretching longer than 30 seconds are basically zero. There's no extra gain in stretching longer than 30 seconds. Now, if that was true, that would basically say that creep, which says the longer we stretch, or as long as we stretch, the tissues will still deform and stretch, that would be untrue. So I just thought I wanted to throw all this in here so you can then, if you want to make your own decisions about how you want to go about stretching and the injuries. But I also want to say some of my stretches are actually significantly longer than 30 seconds. And I hope that you can follow my reasoning and understand what I'm saying here.